Okay, Tom, so we're now coming to the debrief to discuss the scenario. So well done. How did that feel?
Yeah, it's quite difficult. I thought I was quite comfortable going in there knowing sort of what to do, and then as soon as I got there I felt a bit panicked and I just didn't really feel like I knew what I was doing.
Okay. Well, we can kind of take that apart and discuss it. Obviously, this isn't a chance to have a talk about what happened.
Yeah.
There's no kind of assessment. The scenario was one of a patient with chest pain and how to assess it. So, what were your initial thoughts? What happened?
So I got a phone call from a nurse who's worried about chest pain. Got a brief history, his post-op, and about some chest pain. I asked for a set of obs and an ECG to be done, and I'd go around and see him shortly. Went into the room, introduced myself to the patient, and attempted to take a history from the patient.
Mm-hmm.
He described generalised chest pain across the whole of his chest, which is quite severe. Couldn't really go into more detail. He was preoccupied by the pain. So I got a set of obs done. His saturation is quite low, so I started him oxygen. I followed the ABC approach. His airways were patent. He was short of breath and hypoxic, or his sats were low, so I gave him some oxygen. Then assessed his blood pressure, which was he was normal intensive, but slightly tachycardic. His alerts D, and then I didn't broadly examine him. I then got an ECG back, which I saw some ST elevation. So then followed what I recall of the ST or the ACS protocol. So gave him some morphine, GTN, and some aspirin as well. I then called the cardiology registrar saying I was worried about the patient that I thought he was having ST elevation MI, and then followed the cardiology registrar's requests, got full blood count, troponin, and also chest X-ray.
Okay, great. Well, that's a really kind of recollection of what happened. Your initial thoughts, it was quite tricky, but you seem to have had quite a good approach there. You talked about the ABCD approach. That's obviously a good way to assess a patient initially. What were the challenges? What were the tricky parts of this scenario?
I think when we talk about chest pain, we find it's a really difficult thing to examine as opposed to something like an infection of the lungs where you can hear crackles, stuff like that. So a lot of the diagnosis is based on the history. I find it quite difficult to take a history when the patient's in a lot of pain and potentially unstable and preoccupied with pain. So I don't think I concentrated enough on the history to be able to distinguish what I thought was going on before having a look at the investigations.
It can be hard sometimes to kind of tease apart that history, especially when the patient's in pain and they might not be telling you what you've learned from a textbook. How can we approach that? How can we improve that approach?
I think as opposed to being more sort of open and patient-centred, I think it requires you to be more sort of closed in nature and ask things to be ruling in or ruling out stuff as opposed to just broadly trying to take history.
Okay, so maybe using more kind of specific targeted questions. Okay, that's really interesting. Was there anything else you kind of found challenging there?
I found it quite difficult to interpret the ECG in what I felt was quite a time-pressured environment because it wasn't barn door either way. So I found that quite difficult, and I found it's quite difficult being on your own as opposed to having a team or more than one person.
Well, I think that links in quite well together because you mentioned, well, firstly the time pressure, because certainly in the simulation you felt like there is a lot of pressure to get things done at a particular time, but also having a team approach as well. So how did you did involve other members of the team?
Yes.
Who did you involve in this case?
So I had a nurse who was there with me already.
Yeah.
He was very useful to do all the sort of obs and the investigations while I was sort of thinking about getting my next plans. It would been nice to have, and I obviously had the cardiology registrar who's very supportive when I called him. And
I think that's quite helpful to know who is appropriate to involve and how they can help you as well. So bringing it all together and exploring how these are applicable to other scenarios. So obviously we talked about the initial approach, the ABCD approach. We talked about the non-technical side of how you manage in a pressure situation and kind of having particular targeted questions can help with your differential diagnosis. And finally, we've talked about how, you know, working with a team and knowing which team members are going to be helpful or useful as well. Does that make sense?
Yeah.
Good. Can you see how you could use them in different situations?
Yeah, absolutely.
Yeah. I think it definitely applies to a lot, doesn't it?
Yeah.
Great. Okay. Well, lots of really positive things you did there, and I think some really good learning points.
Yeah.
Well done.